Hello and welcome. My name is Dr. Manuel Manotes and I'm a clinical psychologist and a somatic experiencing practitioner. And I want to take this opportunity today to tell you about anxiety and how it's actually possible to not be the victims of anxiety anymore. I have seen it firsthand that no matter with my own personal experience as well as my work with other people, that no matter how intense we experience anxiety, it can be either as recursive, obsessive thoughts or of constrictions in the body, tightness of chest, heart palpitations, just pure terror showing up, panic attacks. Any way it shows up, the anxiety as it shows up, we can actually learn how to work with it, how to dance with ourselves, how to accept ourselves as we are and actually move forward and actually use the energy that anxiety has to move us forward. You see, the way I work is I work holistically. I don't see the person as just anxiety as just one problem in the person. It's a combination of things. For once, anxiety is the actual physiology of anxiety is a normal, natural response of the organism to perceive or actual real danger. So there's nothing wrong with that. We want to be able to have that system in a part of our nervous system in order to help us survive in case we are in a life-threatening situation. The problem is that for series of reasons, partly based on history, partly based on our own ancestral biology and many other factors, our system, our brain interprets situations or different things or even our own thinking as the situations of danger, as we're in threat, even though we're not really. So part of the work, a big part of the work is teaching the brain and teaching our nervous system to settle, to relax, to come to that inner place inside of ourselves that is not affected by it and rest it. And as we do that, as we go deep within ourselves, the nervous system starts reorganizing itself and we're able to start finding more peace, more presence, more immediacy. So I work with mindfulness, with somatic experiencing, teaching the nervous system to titrate, to go back and forth between the triggered events and not. I also use cognitive behavioral therapy to work with thoughts and obsessive thinking and how we project into the future. We're always putting the past in the future, and so teaching ourselves to not buy into that continuous bombardment of thoughts that our mind does. And then we also build presence and build the capacity to meet our experience without getting lost in it and without being swept away by the content. Instead, we are the awareness. We are the ones that observe, the observer, and we learn to find refuge in that place. We learn to find refuge also in external situations, external environments. And by combining all of those things, I have seen again and again people that I work with in my own personal experience, how we little by little overcome and become much more comfortable with the sensations, the experience of anxiety. Anyway, if you're interested, I invite you to reach out and let's set up an initial consultation, and then we can go from there and see if I may be able to help you. Thank you and have a good day. Bye-bye.